Associate Director of Operations at the Center for Global Women's Health Technologies at Duke University. And before we get started, just wanted to go over a couple of Zoom details. So feel free to keep your video on or off. We will be keeping everyone on mute until the Q&A portion today, but please feel free to communicate with each other in the chat section. And if you have any questions that come out during the panel, definitely send those into the chat. I'll be saving them and we'll be sure to get to them when we get to the Q&A portion. So as you all know, this month marks 1 year since COVID-19 restrictions were put in place in North Carolina. The pandemic then disrupted our lives, and many families have experienced incredible loss over the past year. Today, we'll be speaking about the impacts of COVID-19, specifically on mental health in the Latinx community. We're joined this afternoon by two wonderful speakers. Kenny Murillo Bruzelo was born in Honduras, but has called the Durham area home since he was 9 years old. Kenny is a Golden Door Scholar, and he graduated from Furman University in 2018 and worked as a Spanish medical interpreter for 6 years. Most recently, Kenny was a member of our team at the Center for Global Women's Health Technologies before starting medical school at the University of North Carolina at Chapel Hill last summer. Welcome, Kenny. Dr. Gabriela Leyva-Stein is a licensed psychologist and associate professor of clinical psychology at the University of North Carolina at Greensboro. Dr. Stein's program of research identifies individual risk and protective processes for Latinx and other minoritized youth when facing cultural stressors such as discrimination or stress, and seeks to improve mental health treatment access for Latinx families. Her research has been founded by NIDA, NIMH, PCORI, and she is currently the Vice President of Programming for the Society of Research on Adolescence. Clinically, she specializes in the provision of therapeutic services to Latinx families and provides training to providers working within the Latinx communities. Welcome to both of our speakers.
And I'll introduce our moderators. That is myself. My name is Ashley Deans. I am the Communications Specialist at the Center for Global Women's Health Technologies, or GWHT, you might hear us say. And Alexandria was who you just heard speaking. She is the Associate Director of Operations at GWHT. In 2013, I'll tell you a little bit about our center as well. In 2013, Dr. Nimi Ramanujan founded the Center for Global Women's Health Technologies at Duke University with the mission of empowering trainees to create impactful solutions to improve the lives of women and girls globally. This center, since its inception, has catalyzed new research activities and development and commercialization of several technologies that advance prevention and treatment of cervical and breast cancer. We're working together to advance our center's mission of erasing disparities in women's health. While the majority of staff at GWHT come from a science or engineering background, Alexandria and I have the opportunity to focus more on the social and community engagement aspect of our mission, which is what we're doing here today. We recognize the disparities also exist outside of women's health, and we're excited for this conversation to take a look at a little bit of a broader healthcare issue, especially as we approach or we have reached the 1 year mark of the pandemic in the United States. So with all of that being said, I'm going to go ahead and pass it over to our first speaker, Kenny. Thank you so much again for being here today, and you can go ahead and take it away.
Cool. Thank you so much, Ashley. First, I'd like to thank you and Alexandra for putting this project together. And also, I want to say that I'm really thankful to be here and incredibly honored to be part of this project from the center. And thank you for who's here today. Start off my part with a short clip that Ashley's going to play in a moment. And yeah, actually, let's just go ahead and start with the clip. Not sure there's audio.
I was muted. Sorry about that, guys. Here we go. Give me a thumbs up if you can hear when I press play.
¿Alguna vez habéis conocido a alguien que ha estado en un ventilador? Nunca he conocido a alguien que haya estado en un ventilador.
Ahora solo me conozco yo.
Estábamos mudando. Mi papá, mi mamá, mi hermana que nos está visitando, sus dos hijos y yo. Un familiar que nos ayudó a mudarnos y empezó a presentar síntomas de COVID. Queríamos creer que tal vez era de la influenza, la gripe. Yo me acuerdo que le dije a mi hermana, no, esto parece COVID. Cuando todos estamos enfermos y pues usted decía que usted no se iba a enfermar.
No me enfermo.
Como decía usted es un roble. Y es cierto.
Yo fui el último. Me pegó bien bonito para que vean que esto es real. Los síntomas fueron diferentes. Ustedes perdieron el olfato, yo nunca lo perdí. Yo comencé con una tos seca. Luego fue la fiebre. Yo recuerdo que el domingo nos durmió. Mis sábanas me las cambió 3 veces.
Sí.
Yo las mojaba con la fiebre que me estaba pegando.
Mi hermana es doctora en medicina. Me dijo, hermanito, necesitamos comprar un oxímetro, necesitamos revisarle los niveles de oxígeno.
El oxígeno en mi sangre comenzó a bajar y a bajar.
Me acuerdo muy bien que le dije, papá, eso era el ego.
Yo me sentía tan mal que yo no pude resistencia. Yo ya sentía que ya no estaba respirando.
Mi mami pensaba que o se iba a morir si le iba al hospital o pues simplemente no iban a hacer nada, pero yo lo quería llevar. No sé cómo se sentía, papi, sobre seguro me pensó en eso.
En ese momento no pensé en nada, porque lo primero es vivir.
Salí de emergencias y a mí me dolía la ropa. Eso para mí fue muy, muy duro.
Es bien doloroso, la verdad, es bien doloroso. Mi nivel de oxígeno marcaba 93, pero mi respiración ya estaba bien complicada. La muchacha que me atendió, ella decía que yo tenía que tener menos de 88. El intérprete solamente me dijo, te vamos a mandar para tu casa y no te podemos hospitalizar. Yo me paré y caminé como 8 pasos. A mí se me salieron mis lágrimas porque yo ya no podía respirar. Y yo quería demostrarle a ella que yo necesitaba oxígeno.
Recibo la llamada del hospital. Estamos pensando en darlo de alta. Hay alguien que lo pueda venir a traer pronto. Me quedé en shock. Y le digo yo, no, él no está bien. En este momento tienes la oportunidad de hacer sentir a alguien mejor. Esa persona está enfrente de ahí y esa persona es mi papá. Y me acuerdo que me dijo, ok, seamos luego. Y me colgó.
Me llevaron a un cuartito, ya me pusieron oxígeno. Me empecé a respirar mejor y ahí me tuvieron hasta por la noche. Ya me anestesiaron y me intubaron. Yo lo que sentí fue impotencia y al mismo tiempo, ¿sabe qué pensé? ¿Qué pasará con tanta gente que habemos en este país que no hablamos ni inglés, ni tenemos a nadie que pueda hacer una llamada por teléfono y preguntar por qué razón los están mandando para la casa? El enfermero no está en nuestro cuerpo, no sabe cómo nos sentimos en el momento. Quien sabe cómo nos sentimos somos nosotros. Si nos sentimos que estamos mal, tenemos que aferrarnos a ese derecho de que necesitamos un tratamiento médico. El apetito me volvió triplicado. Perdí 39 libras. No quiero recuperarlas todas, pero sí tengo que recuperar un poquito porque estoy muy débil.
Te amo, papi.
Lo amo mucho yo también.
Thank you so much, Ashley. So, I don't know if any of you have with COVID yourself, or if your relatives have, or if you've had any experiences with a case of COVID that got bad, that got complicated, right? Like we hear in the news. But this clip really shows you a little bit of how scary that experience can be, and how bad it can get, especially for communities who are more vulnerable. There's because of language barrier or other things. So that man, his name is Saul, and he was hospitalized, and within less than 2 days after dropping him off at the hospital, he was put on a ventilator, and his health kept deteriorating to a point where the doctors really weren't giving much hope. They didn't know where things could go. So that man is my dad. The voice of the guy, the boy that you hear, it's me. And about 10 months ago or so, I received that phone call from the nurse right after I had dropped off my dad at Duke at the hospital. I couldn't quite drive home. I was feeling quite distraught, and I remember I pulled over at a gas station, and I was there, and had to to myself. And it was right before I was gonna drive home that I received the phone call. And I was really shocked because I couldn't believe it, that they were saying that I could go pick up my, I wasn't, generally that's probably a call that will make anyone happy, right? To say like, you come pick up your relative, that would generally mean that things are good. But I knew things were not good. By that point in the summer, I had already received my stethoscope. As you heard, I'm in my first year of medical school. My sister was visiting, and she's a doctor herself. And yeah, I had my stethoscope. His right lung was collapsed. We had been checking him. We had been monitoring him around the clock. I was literally setting alarm clocks every 3 hours throughout the night to check his oxygen levels, to check on him, to give him medicine. And I knew that he couldn't go home. But something that I remember really clearly from that day is that contention, that really fight that I had with the nurse over the phone, who insisted on picking him up. And there was something that she said that I will always remember. And she said, I kept insisting that my dad was not doing well at home and that he needed oxygen. And I kept insisting on the fact that he needed a full workup and that he needed oxygen. And the nurse literally said, and I quote her, "There is no oxygen treatment. What do you mean oxygen treatment?" Which was ridiculous. He made me really angry because I had worked actually for about 4 years at the same hospital as a Spanish medical interpreter and 2 years elsewhere. And I couldn't believe that she was telling me there was no such thing as oxygen treatment. There was no oxygen. Anyways, I told the nurse I was not picking him up for workup. I literally had to tell her what they needed to do. I was asking for a chest x-ray. I was asking her even listen to his lungs and his heart. She hadn't. I don't know why they were discharging my dad. She hung up on me, but 2 hours later, they had done more of a fuller workup, and they decided to hospitalize him. I'm happy to say that weeks later, things did get better, thankfully, and my dad was discharged. But something I want to talk about was last summer here in North Carolina, how bad things were for the Hispanic and Latinx community that makes about 10% of the population in North Carolina. We were making about the 46% of the positive COVID cases in North Carolina were Hispanic people, even though they only make 10% of the population. And even in Durham County, which I'm really proud of to say that I'm from Durham, things were quite bad. In Durham County, the Hispanic population makes about 15%, but 77% of the positive COVID cases were Hispanic people. So over half of the population in Durham and about half of the population in North Carolina of positive COVID cases were Hispanic people. So something was obviously wrong. And then, we had individuals like Senator Tom Tillis, who last summer, you may or may not remember, he basically blamed the Hispanic community for the surge in COVID. And I think we can all agree that that's not leadership. When you demonize for something that you have failed to do, for failure of leadership and trying to find solutions, and what you do is you blame people. And in this case, the Hispanic community was being blamed for that, and that's definitely not what we need. And I think something that I want to emphasize is what a really amazing and powerful group of individuals did at Duke as well. La doctora Bianchi and doctora Maradiaga Panayoti, there were two physicians at Duke who cared and who wanted to change things, right? And they created the Latin-19 coalition. And their first meeting was actually a year ago today, March 18th, 2020, was when the Latin-19 coalition met for the first time to try to figure out how to assist the Hispanic community and making sure that they were also getting the the support that they need. They need it. And so they have been a strong force in the community in making sure that the Hispanic community is not forgotten, that they're not simply blamed for what all of us are really experiencing. So yeah, those are just some thoughts. And something that I want to mention also right now is the really disparity that we're seeing with vaccination. And that's now the other big issue I would say that we really need to focus on, is making sure that the communities that are very vulnerable are getting connected to vaccination programs. So now we're seeing, sorry, I'm reading maybe I'll read the chat a little later. But yeah, I was looking at some numbers earlier this week, and in North Carolina, for example, about 10% of the population in North Carolina is Hispanic, but about only 4% has been vaccinated. And depending on the county that you live in, it's even worse. For example, in Duplin County, which is, I believe, by Wilmington area, the Hispanic community makes about 20% or so of the population, but only 2% of that community has been vaccinated. So obviously there are really grave disparities in what in which communities have been vaccinated. The Black communities and other community has not being represented when it comes to vaccination programs. So just yesterday, I was volunteering at a vaccination site here in Orange County, and I'm now that's where UNC area is, and that this is a county I will say that is doing a excellent job at making sure that they are reaching out to all communities. And for example, 9% population here in Orange County is Hispanic, and they are vaccinating about a little bit over 6% of the people vaccinated in Orange County have been Hispanic. And something that really shocked me yesterday when I was volunteering in the afternoon is I'm pretty sure every person that was, it was a drive-through, I'm pretty sure every car that was driving through was Hispanic. And I was a little bit confused because I was like, I did not expect this. And so I was asking some of the leaders there who were organizing the event if, was this like a Hispanic event? It wasn't, but it seems like they were trying to really making sure they were reaching out to those communities. So there was text message programs. They were reaching out to different schools, which is how I got connected to volunteer, but to try to get all those people, Hispanic people, to come to the event and get their vaccine. And I think it was, for me, it was a really special, a special moment to see that. And I was really glad to be there. I was able to interpret. I wasn't administering vaccines at this site, but just being able to help families and hearing their stories about how hesitant they were about getting the vaccine, but ultimately they were there, and hearing their stories really encouraged me to keep volunteering, right, and keep having these conversations with community members. So I think my time is up for now. That's all.
Thanks so much, Kenny, for sharing. For anyone who has questions specifically for Kenny, go ahead and send those over in the chat, and we'll be sure to address those in the Q&A in just a little bit. And we're going to go ahead and pass it over to Gabby now.
Hi, everyone. Thank you so much for inviting me to be here. And thank you, Kenny, for sharing the story that I think is one that many families have faced as they sort of fight for sort of having the medical care they deserve at this time. I want to start by saying, as in my introduction, I'm a psychologist, and I've been working, I have a large grant right now that we're looking at training community health workers in the delivery of mental health interventions for underserved communities and primarily the Latinx community. So we started working on this grant more than a year ago, and COVID-19 hit. And one thing that we do is that we are, just to show the mental health ramifications of this pandemic in the Latinx community, is that we've been now sort of doing screening for folks to see if they qualify for our study based on high symptomatology of depression and anxiety. And one thing we've noted since the pandemic has started, when we started working on the project, we would go out in the community and we'd have about a 30% eligibility rate. So that meant that folks had significant symptoms of anxiety and depression and had no current mental health treatment. And right now we're at 50%. So we've just witnessed ourselves, so the increase in the mental distress that folks are reporting due to the pandemic. And it's not just sort of the lack of access to care, the worry about the vaccine, it's all of the ramifications people have seen in the news in terms of job loss, food insecurity, housing difficulties, so that all of the social determinants of health that we know are so critical to support the mental health of communities are even more eroded for the Latinx community. A lot of the clients that we were working with had family members that lost work in the food industry. And at the same time, we had other folks that were being forced to work because they were part of the essential workforce and didn't feel like their environment was providing them with the sufficient protections for them and their families. We know that sort of families tend to live in more crowded housing. Some of the families we would work with didn't have the ability to isolate. So once a family member had symptoms, there wasn't the ability to sort of isolate to keep that from spreading to the rest of the family members. That was really distressing to a lot of the family because they sort of felt like there was nothing they could do. And then the lack of access to care and ability to go in and see medical care was also really important. One thing I also want to highlight is I'm Mexican myself, and a lot of my family still lives in Mexico. And another thing that has been really difficult in this pandemic, as we've talked to clients and my own experience, is how the pandemic is affecting people back in their home countries. I'm in Mexico, it's running rampant. And in fact, I lost my uncle to COVID-19 earlier at the beginning of the year, and how difficult it was for our family not to be able to mourn, not to be able to have the funeral, not to be able to have the rights that are associated with my uncle died alone. And I reflected on when my other uncle passed away, how the entire family was able to be at the hospital and support our aunt and support our family, and how we had no ability to provide that type of support. And not only that, his widow was herself battling COVID-19, and we were very worried about her own symptoms as she was going through this tremendous loss. And this has happened across a border where we don't have a lot of information. We don't know what's happening. So I think the other piece that's important to recognize is not only are the concerns present and here, but because of sort of the way that Latino families typically cope and focus, right, and have sort of the familial support around everyone, to not have that, I think has also been an added devastation, right? To not have those social connections, to not have the ability to support families in the way that we do. A lot of my work has focused on the role of familism values, sort of this duty and loyalty and honor that we have in Latinx families. And typically these values promote better mental health. They're typically associated with meaning and purpose in life. They're associated with connection and support. But unfortunately, because a lot of our networks have been shattered by this pandemic, the very thing that is something that's usually a protective factor can be one of the things that also makes this very challenging. So I want to just say that we've witnessed in our own study, and then with working with clinicians in the community, the fact that there are wait lists for folks to seek mental health care where they're not able to access that care. And in particular, there's folks that are at a particular risk that we've noticed if they've experienced past trauma in their lives, if they've had other sort of pre-pandemic kind of mental health difficulties. The pandemic has only exacerbated these difficulties even more. The other thing we've witnessed, unfortunately, and this has also been something that's been reported on in the news, is because of the coinciding of the pandemic of COVID-19, as well as the continued policing of Black and Brown families and continued sort of fear and documentation fear, and sort of that families aren't seeking support in part because they might fear they may be on a public charge and be on a list, so they're not accessing some of the supports that they have rights to have. And there's been a lot more change in the sort of the ability to even access care. So there's increased fear that has also made it challenging for families and that we've worked with. On the positive note, we have seen some families talk about how this pandemic has allowed them to spend a little bit more time with family and connect. And so that we have seen some of the positive parts that have been shared and that have been shared in the pandemic. But on the negative note, at the same time, when families are stressed and in home and together all the time, that has also led to some increases in domestic violence, and that families are having a hard time sort of finding ways to get support that's culturally appropriate and that sort of provides the support that they need. So we've really witnessed throughout this pandemic a devastating impact on the Latinx community. And I also want to highlight that we have also noted an increase in suicidality in our study that we had from prior to the pandemic. So suicidal thoughts, particularly around just life not being worth living, just not feeling overwhelmed, feeling overburdened, feeling like there's no way to escape. So that's something else we've noticed in our study that we've been able to sort of document, is sort of this increases in suicidal ideation. Before the pandemic, we probably had maybe, I would say, one case a month that we would deal with that. And now it's definitely more than a weekly occurrence. So it's something that we really noticed significant increases in that. And what is really difficult is that for a lot of these folks, they have no access to healthcare, no access to other supports, no access to places in which they can receive continued support. Some of the folks that we've worked with, I remember the story of one man who we sort of approached at a community event where we've been at a lot of the food distribution sites and places where people are asking support. And the man started crying. He's a Latino man, older. And he said, I've been looking for someone to support my mental health for 2 years, and I haven't yet been able to find it. So I think it's important to note that that the pandemic not only has this devastating effect on just the health of our community, but the mental health as well. So I know that I am out of time, but I wanted just to share some of the devastating toll the pandemic has had on the community's mental health. And I appreciate the numbers that Kenny shared, because those sort of are the where we see the morbidity, but we also see sort of the mental health cost. One last point I will make is, as you heard in my introduction, I'm also do a lot of work with adolescents. And one of the things that we really noticed with adolescents at this time, that they also were struggling in some of the losses that they had across some of the transition points that they had, some of the ways in which they weren't able to parents weren't able to go to graduations, parents weren't able to see some of the things that they've worked so hard in the community to achieve. And so some of those like other pieces of the transitions that we see that all kids are going through, so not just Latinx kids, but the meaning of that in a community where that graduating is such an enormous accomplishment and something that is the culmination of sort of the immigrant dream to come and give your kid a better life. The loss of those moments has also been very devastating as well. So I will stop there to open it up for the next part.
Yeah, thank you so much. That was fantastic. I'm just pulling this back up again. Oh, you got a sneak preview. So yes, thank you so much to both of our panelists for sharing. You guys are fantastic. We're now going to open up the floor for Q&A, and there are a couple different ways to do this. So if you have a question, you can send it in the chat, and Alexandria or myself will go ahead and read it out loud to our panelists. You can direct it at one or both of our panelists. Also, if you want, you can raise your hand using the raise hand feature on Zoom, and we will unmute you. You can turn your video on and you can ask them yourself if you'd prefer to go that route. So we'll give people a second here to kind of think about their questions, get them typed, raise your hands, but we have some time for a Q&A now. Oh no. Well, I didn't mean to click on this, but this is fantastic. Thank you.
I also wanted to say that there's a upcoming for folks in the Burlington area. There's a FEMA sponsored, I'm going to put it in the chat, vaccination drive that they're doing this weekend, that they're really trying to reach the Latinx community. So I'm going to put it in the chat. They're still looking for, they have lots of appointments available. Those are targeted to the Latinx community. So I'm going to put them in the chat in case people know folks in that area.
I see Heidi has her hand raised. I hope it's pronounced Heidi. Heidi, you can go ahead and unmute and ask your question.
Thank you. My name is Heidi. I am from The Mighty, which is an online health publication. And I'm just wondering, in terms of PTSD diagnoses, are you finding that there is more diagnoses that are happening now because of COVID? I know it takes some time to first seek help for that and then to find a diagnosis, but since it's been about a year now, I'm just wondering if, Dr. Stein, if you've been seeing more of that, and if so, if there's a difference between the Latinx community and non.
Thank you. That's a great question. And our particular study, we assess for trauma, but we don't do any formal diagnoses. And the rates of trauma have been similar across time. So we haven't noticed anything in our particular study, nor have we looked at the trends very closely. So I will say that we still haven't done that. When I was preparing for today, I did look at sort of some of the larger literature out there in terms of what they've found in terms of disparities around mental health. And I didn't see anything for PTSD. But I think you're right that the trauma that families are experiencing, we're going to start seeing that come in, particularly as people feared for their safety, for their lives. So I do believe we're probably going to see some of that. And because of the disparity of who experienced that level of fear, the helplessness that was really clear in the video that Kenny showed, right? This like, I can't do anything here. And I wasn't able to impact that. I think we'll see that more in the Latinx community, but I don't have any data to share to that point.
Great. Thank you so much for sharing about that. So we have another question that came in through the chat and just kind of wondering for thoughts on having to be vaccinated to attend school in the fall. Kenny, not sure if this is a question you want to address since you are a student right now.
Wow, it's an interesting question. So I was vaccinated in January, and that seems like a long time ago, right? Especially given that most people haven't had access to the vaccine. So I recognize it's a huge privilege. When I got the vaccine, I literally cried. I couldn't believe that had just happened. It took, less than 3 seconds. The process was super easy, super simple. And I had to really reflect on the fact that if I were not a medical student right now, I don't know when I will get the vaccine, right? I'm a young, healthy individual. I will probably last group like sometime in the summer or later. So I do recognize that that's just a huge privilege to opportunity. I know there's a lot of urgency for all schools to open and for in-person learning to happen. I'm not an expert in public health, and so please keep that in mind. I will say that anyone who has the opportunity to get vaccinated today should do it. The more people that get vaccinated, the better it will be for everyone, for our communities, regardless of who you are. But we also want to be very cognizant that there are communities that should have priority, which is why we have the various groups that but I think hopefully that will change now that we have the Johnson & Johnson vaccine is an option, and hopefully the concern, the worry about prioritizing certain groups and things like that will be mitigated. That is my hope. Dr. Stein, I don't know if you have more of a professional.
Yeah, the only thing I would say is, and I think what Pooja's getting at, is that there are some folks that have some hesitation, right, about the vaccine, the safety that has been shown in different communities. And I think it's important for the science community to be able to communicate effectively with different folks to sort of assuage those worries and to sort of say, here's where the science and the benefit is. But I understand if we have, for example, some of our community health workers in our project don't want to get vaccinated, if I use the right term. But right, and so that's their individual choice. And so, we sort of just provide that information. So I do feel like a mandate like that could be really challenging to enforce, because different communities definitely have fears that are based in sort of the idea, sort of their own sort of communities' distrust of the medical system. So I think that that's a very complicated question, but I think what we should probably do is just try to get as many people as we can vaccinated, and support that and provide information for everyone to have access to the knowledge to make a decision that's informed for themselves.
I'd like to add the experience I had with my grandmother. My grandmother, who's of age and beautiful, she got vaccinated several weeks ago, and I had the honor or uncomfortable honor of handling that situation, because there were people in my family who didn't want her to get vaccinated. But obviously someone who I trust that the vaccine is safe. I got it myself, like I said before. I thought it was the best thing for her to do. And I had those conversations with, we had a group phone call with my aunts and my uncles who kind of, we all deliberated, was able to answer some of their concerns. And we talked about some data, and they had a lot of mistrust. People are saying a bunch of different things, and I think you need to be informed and look at where you're getting your sources from, right? Or maybe just watching a random YouTube video of someone claiming this and that. I think doing some homework and back work on where is this information coming from, it's
Great, thank you both for sharing. So another question that's come through here is, are there vaccine sites across the area that are needing Spanish speakers to help the Latinx population with sharing information or anything else?
Sorry, Dr. Stein, I wasn't sure if you were gonna go. I was gonna go. Yes. For example, yesterday I signed up through Orange County Health Department, and I was serving the role of an interpreter, and there was several different roles, and I think, especially if you're someone who's bilingual, you should definitely be volunteering, especially helping those communities, guiding them through that process, because there was a lot of different stops that they had to go along the way when they were driving through, and you could really see how much they appreciate it, because a lot of them are fearful for various reasons, and then there's follow-up information. They're getting Moderna and Pfizer. You want to know when they need to return for the second dose. So I would say go to Latin19 if you're in the Durham Triangle area. Look at your health department and what they're doing. If you don't think they're doing enough, then I would encourage you to take on that leader role and ask about what we can be doing better, or what you and maybe your friends who are also bilingual and want to get involved could be assisting them in making sure that you are also helping those vulnerable communities.
I would also want to say that the North Carolina Department of Health and Human Services has just hired Yasmin Garcia Rico to be the director of Latinx and Hispanic policy and strategy, and she's working really hard around this issue. She's the one who sent me that the piece around the vaccination. So I would suggest going on that website and seeing if there's anything they've put out there as well. I haven't looked specifically. I know that there's some websites out. If you reach out to me, I know we've developed, as part of our project, we're handing out information about the vaccine when we screen people, just so people know. So I'd be happy to share that. If you just reach out to my email, I'll put my email in the chat.
Thank you both. That's fantastic. We have another question here from Abigail. I think this is great. Abigail says, I also work at a vaccine registration event, and I've seen a lot of Latinx families get excited and sign up for the vaccine. However, of course, I come across people who are hesitant and don't speak to me about why. How can I try in those moments to encourage those people who are more hesitant? What can I say?
Totally valid, right? I will say, most of us like talking, like sharing things, and sometimes I think if you just allow even some silence, or if you prompt them by asking them, like, are there any concerns that you have? Are there any additional questions that you have? What was your experience in determining, like, your decision? Is there anyone in your family? Like yesterday, I was with a lady and she was telling me, I really want to get it, but so and so didn't think so. And I was like, oh, I was like, cuéntame más, dígame más sobre eso. Like, tell me more about that. Because then, even though maybe she is, I hate to say pro and anti-vaccine, I don't want to use that language, but even though she wanted to get the vaccine, some of her friends were more hesitant. She still showed up, which is great. But then I kind of wanted to hear those stories about her friends who are more hesitant, so that we can be more informed. But I think, giving them the space, and by prompting them, just asking them if there are concerns, what was the decision process like, what was it like to get there to that site, right? Because sometimes these people they may not have a car, they may have to borrow a car, they may have to get a ride, so there may be other things at hand more than just being afraid or not, or deciding on to take the vaccine.
Yeah, I would also suggest using some motivational interviewing techniques that you could use to sort of really first highlight. You start with like, well, if they don't tell you your hesitancies, you can talk around what would be reasons to get the vaccine, what are your goals, what would be sort of really get them to talk about their pros more than talking about their cons, because sometimes that can be really helpful to folks to really say, and what would it take? So sort of right now on a scale of 1 to 10, how excited are you to do it? And if they say like a 7, they're like, okay, what would it take to get you to a 10? What's the information you're needing? What's the information you need? So moving and like sort of focusing not like necessarily just like on the pros that they see and the things that they have, that might then, as you're hearing them, they might say, well, here's my worry, or here's my hesitation. And so providing some validation for that, and sort of saying, yes, that I can understand that if a lot of people are feeling scared, here's some places you can get information. But that could be a way to sort of prompt that goal talk, the positive talk, the talk towards the vaccine can be really useful.
Yeah, if I could just jump in with that, Kenny just sent something that I think is an excellent point into the chat. He said, I also shared that I was vaccinated and how good that was for me as far as feeling less anxious, more hopeful, et cetera, et cetera. I'm sure that, if you're working in a vaccine clinic, or for anyone else who has friends or, people that are maybe uncomfortable, of course you can tell them all of the research, all of the facts about how it's safe and all of that, and that's fantastic, and you should know that information. But from a communication standpoint, hearts are rarely changed by facts. So I think trying to get to know people on a personal level and sharing your personal experience, like Kenny just said, I was vaccinated and I feel so much better, that kind of thing. Getting to know, the person behind the fear, that sort of thing could be really, really helpful. Yeah, Emily just added to the chat too. I love using analogies to teach others about vaccines. I really do believe that education is key, but educating with words that they understand. I think that's a great point.
So we're going to go on to another question from the chat. This is for Dr. Stein. From your current research, what are the most significant metrics in evaluating Latinx mental health? Which finding concerned you the most?
Yeah, so on the whole, Latinx communities experience a lot of disparities around mental health, and particularly around depressive symptomatology. We see really high rates of depressive symptomatology and suicidal ideation that relative to other racial ethnic groups in the United States, particularly in younger populations. So I think for me, one thing I'm really worried about is the fact that we have these high rates of distress, and yet there's not the mental health support that's easily accessible. So I saw someone shout out to El Futuro. I've been working with El Futuro since I was a graduate. I actually am a graduate of UNC Chapel Hill's program, clinical psych program, and they are great and doing great work. And I was just talking with one of their directors yesterday, and they have a 200-person wait list. So I feel like what worries me the most is the fact that people, I think a lot of folks talk about the stigma in our community around mental health support, which exists. I don't want to say it doesn't, but I think sometimes that's overstated. And what we really should focus on, how do we do the outreach to the community to provide the support that they need and that they see as useful to them. And that when you meet people where they're at, people are interested in wanting that support. So the thing that concerns me the most is the disparity. In sort of epidemiological studies, they found that only 8% of Latinx folks who have mental health diagnosis actually get therapeutic services. 8%. I mean, that's really concerning.
Yeah, thanks for sharing. That is definitely concerning. I'm going to move to another question in the chat. After this, we probably have time for one or two more if you want to send your final questions in. This says, Kenny, how has your experience as a former GWHT fellow helped you to respond to this international crisis and cultural challenges within your personal community in North Carolina? What overlapping frameworks do you recognize in advocating for Latinx and minority health rights from women's health?
Wow, Paolo, those are big questions. I will say that I have not been as active in volunteering or having such an active or leadership role right now with vaccination programs and things like that, because I'm in school, and medical school is incredibly busy with, honestly, keeping up with everything that's going on is the hardest thing of medical school. So I will say sometimes I feel guilt about that, actually, but then I have to remind myself to be compassionate with myself and the fact that I'm trying to focus on a certain thing, which right now is my medical training. So I'm all that to preface my answer to your question. I think it's yesterday, one of the persons that was volunteering next to me, we kind of tag teamed. I never met her before. Is like she works for the public schools, and she helps families learn about the process of like helping your kid go the K-12 school system here, immigrants, and she's an immigrant herself. And she was telling me about her work, which she loves, and families she's graduated, who she has been able to help, and how many she's working with. All that to say that I see her as a great leader. And I was telling her how like those families she's helping are probably becoming leaders themselves in helping their friends. This reminded me in some ways about the Wish Revolution, which is one of the programs at GWHT. Focuses on training women in Peru to talk to their neighbors and really their smaller communities about cervical cancer research. And in a way that is the power of the Wish Revolution, are those being able to work with the stakeholders, with the people directly affected, and empowering them to become leaders themselves. And I think kind of what I see with the vaccination programs and being able to address the disparities that we're seeing right now in vulnerable communities is helping people who are members of those communities, empower them to become leaders and to talk to their neighbors, to their relatives, and to also share about their experience and for them to do the same, right? I believe that maybe addresses the first question more or less, what overlapping frameworks, and maybe some of the second one.
Great, thank you, Kenny. So I think we'll go ahead and close with a couple of thoughts that have kind of been coming through the chat about the different vaccines, and was just curious to hear from our speakers. If you're working with somebody and they don't want Johnson & Johnson because they've heard perhaps that maybe it's less effective than other vaccines, maybe some people have heard that J&J was developed and made via the use of cells from aborted fetuses. Someone else typed in about a high Catholic population that people are working with. So just wanted to kind of open up the floor for a little bit to see if either one of our panelists today have any insight on how to address those questions around vaccine creation, kind of before people get to that process of thinking about, do they want the vaccine, which vaccine may or may not be the best option for them.
So I hadn't heard that about the Johnson & Johnson vaccine, so that's something new for me. But I can understand that being a concern for folks if that's something that they, feel. So I think one thing to know, to know these, right? What are the things that are out there, and then how, where can people find out real information? I think for me, part of the pieces that I've seen a lot talked about in my social networks is just some of the disinformation that's out there that's very purposefully targeting different communities, and sort of the fear and how that sort of, so helping, I think partly is also sort of helping, like, where are places you can trust, what are news organizations you can trust, what are stories that are useful, and providing people with that ability to have that information and access, and sort of what does it mean when it's made with, or if it did involve any sort of aborted fetuses, what does that mean in terms of the scientific component. But again, I think it's important to honor people's values and beliefs as they engage in medical care. And so I think I think the important part is knowing what those myths are, and knowing, are they true? How are they based in truth? And then how can you provide just the information that people can make their own choices? I think sometimes the mistake we make is, we try to just say, to, like, as Ashley was saying, just like trying to convince people, and that's not going to meet them where they're at, meet them at their concerns, and help them access the kind of information they could use that's in the ways that they can potentially make the best use of that information.
I had heard about this a little. I'm glad you mentioned how it's Johnson & Johnson vaccine is only marginally less effective, because actually my roommate's mom didn't want, they're from Mexico, and her mom is very informed, and she's like, I don't want it because it doesn't work as well as the other one. She didn't get the Johnson & Johnson, she got Pfizer, which is great too. If I had the option of getting the Johnson & Johnson, I would have gotten that one. At the time, it was not an option for me. But I think the word option is where I see the light here, is that thankfully we have different vaccines. We have Moderna, we have the Johnson & Johnson. So if there's someone, I agree with Dr. Stein completely. I think their religious background and beliefs need to be respected. That person should not be pushed to get the vaccine unless they themselves change their mind or their position on it for whatever reason. I'm not sure I have a great whether those individuals should or not, other that it's their decision. But there are other options.
Great, thank you so much. Thank you to our panelists. Thank you to everyone who is sending in questions in the chat and asking questions. Here we have some resources for you, things you can listen to, accounts to follow for more information. Also, throughout this panel, a ton of people have sent resources in the chat, which I think is super awesome. I just sent my email in the chat. If you have additional resources, you can send them to me. We usually send out a follow-up email after these panels with a survey that we would really appreciate if you take, so we can make our events even better, and just, again, more of these resources like what you've been sending. So if you have something you want to share with me so I can share with everyone, that would be fantastic. Thank you. And then lastly, I just wanted to say a big thank you to every single person who attended today. We really appreciate you giving up your lunchtime to be here, have this awesome conversation. Big thank you to both of our panelists. I hope you all have a fantastic rest of your evening and afternoon. All right, thanks guys. Bye everyone.